It's important to have good communication when you're calling 911. In having children with mental health emergencies or emotional needs, it's really important that you safeguard and you have the information that you need. Always tell the 911 dispatcher that you're calling regarding a medical emergency. Mental health is a medical need. It's important to explain if your child has a diagnosis and what the outcome is. Are you wanting your child to be transported to the hospital? It's very important to say that there's a mental health crisis, but actually naming it as a medical crisis. Don't allow your emotions to take over. It can be really difficult as a parent to call 911 because you know that sometimes things are out of your control. In having children with special needs, emotional needs, and mental health needs, it's important to keep your emotions in check. Tell the officers directly what your need is. What is going on specifically that you need, a mental health evaluation, and how can you get there? If there are specific officers that have helped you in the past, or you've gone down to the department to have a conversation about your family's needs, it's often important and can help if you name the officers that have helped you, whether it's a sergeant, somebody that's been trained in crisis management, or somebody that really has a connection to your child so that you can have the best outcome. One of the pieces that we've often heard at PAL, and even from my children directly, it helped when officers arrived on the scene not in an actual uniform or even a police cruiser. It can be something that you can ask for. It can't always be given, but it's important to say that having the sirens on, the lights shining as they come to your house can be a challenge. So it's important to give that clear information to the police when you do call. There's also an important piece to remember to keep both your child and your family and the officer safe. It's important to make sure that there are no items in your children's hands when they arrive to the scene. That can be looked at as a weapon. It's often something that is out of our control, but it would be important for you to both talk with your child and plan with your family of what you will do if there was an item actually in the hand of your child. Another piece that you want to keep in mind is if you are in the police department or vicinity where it can be recorded, it's really important to have the most positive interaction with the police officers and emergency responders as possible. That would include having conversations, saying yes ma'am, yes sir, being able to have eye contact the best of your ability, not having a lot of body language, and trying to be very clear that there are possibly professionals involved in your life that know that this mental health emergency is happening. One of the things also to keep in mind is that if you are at the police department, it's important to consider that if they ask you not to record, often that is considered waiving your rights. So you need to determine what your family needs, what the information is for your family, and how that will impact your child or loved one. We have within PAL two things: a publication called the Police Pocket Guide that you can find on our website and download to have beginning conversations or future conversations with the police. And we also recommend the Helping Your Family and Child Guide by Judge Baker. PAL believes that planning and pre-planning for all crisis is an important piece. We also have trainings available, pre-planning for mental health crisis. It really walks you through how do you plan. Just like when you have a child, how do you pack that maternity bag? This training will also help you, how do you pack to call 911 or to go to the emergency department or community centers. We know at PAL that families, children, and youth can have success when accessing crisis community services. It's important to have all of the information to plan for the crisis the best of your ability and try to control your emotions. Call your village, call your network, and know that this is a moment in the path of your child and you're going to get through it. Follow PAL for more information, and we hope this is helpful.